Welcome all to the family of Medico Abroad. I never say that it is like in a consultancy which is sending you for a medical education abroad. So please, my dear students, pay attention here. I'm going to take few moments of yours, but these are most precious moments I'm telling you right now. Okay. So I'm telling you why, because this is a family of Medico Abroad. Cause Raghuram sir and Rajaram sir, they are not only concerned about sending the students to particular university. You can see their support after this, their real support after this when the students require. The first thing to begin with is what I'm trying to tell you here is regarding whatever you have gone through since morning. Since morning, like you have been going through with all the sessions, what to carry, what not to carry, along with you, and what to keep in the clothes and everything. Everything you have learned. I agree that is mandatory, that is compulsory. That is one thing you have to learn first thing when you're going. But now I just want to shift your attention. Please don't forget why you are going there. That's the primary thing. We are going for studies. So welcome, my dear friends. Now I introduce myself here. I'm Dr. Mohammed Azam. I have been through many universities teaching for MCI as well as for USMLE and all those things. So take everything along with you, leave whatever not required with you, all the things from morning, whatever you're learning and whatever sir is telling for you, it's all mandatory, everything is done. Now please welcome, I will introduce to the main primary thing why you're going there. Okay, now you're going there for studying, and let me introduce you, let me make you aware of few things when you go there. Okay. Now, first of all, to begin with, I'll take few moments, 1 or 2 minutes, and just tell you one simple story. What is required? Okay, ना? Why? Because I have been through this recently. मैं अभी recently मैंने एक student से देखा कि एक छोटी सी mistake हो गई थी. So because of that, I just want to tell you one simple story. I think, have you ever seen in your life a typewriter? Yes? Come on, just be interactive with me. Say me yes or no. Have you ever seen typewriter in your life? Why? Because why I'm asking you this question is that nowadays you people are all, this is the era of smartphones, the touch, all everything. I don't know whether you have literally used typewriter or not. What happened is when I was into my medical schools and all, one of my friend, he gifted me, very close of my relatives actually, he gifted me a typewriter. I was just thinking, yaar, at that stage of life, most of us, at that stage of life when I was almost like your age and all, I was expecting some nice gift, something like PlayStation, a video game or something. He gave me a typewriter. I started using a typewriter and all those. Slowly I got used to that and all. And after few months, that my relative met me again, and he was asking, "Are you using that?" Yes. And I was somewhere in my medical school at that time, and then he told me back, "Why did I give you?" Have you ever used a typewriter? Once you make a mistake in typewriter, it will take a hell lot to rectify that mistake. Will you agree? Nowadays it's an era, that's what I'm telling you, it's an era where you just copy paste things and that just by touch it's happening. But what habit he has inculcated in me, is that whenever in a medical profession you say this thing has to be the treatment of this thing has to be the drug of choice, you should be rock solid there. You should, whatever treatment you're giving there, you can't make a mistake. You can make a mistake here while learning, but in the hospital, you are not allowed to make a mistake. Fine. I'll tell you what is the moral of this story right now. Any of the students sitting here, can you tell me the formula of nitric oxide? Let's begin. Nitric oxide, sir. Anyone raise your hand? You're nice to say. Make mistake. Here is the stage where you can make a mistake. I'll teach you. I'll make you learn. Can anyone say the formula of nitric oxide? N2O. Raghuram sir wants to say N2O. N2O. Chalo. Let me tell one more thing. I'll teach you one nice point. Let's begin the education from India before takeoff. Okay. Can anyone tell me now the formula of nitrous oxide? Nitrous oxide. Nitrous oxide. My dear doctors, come on. My dear budding doctors. Now, I'll tell you why I'm asking this question. Suppose tomorrow, what we are believing right now, after 5 to 6 years of your MBBS education, you come out, you come back to India, you are right now, yes, employed. Right now, you are in the emergency department, you are in a night duty emergency department, you are there. And then suddenly, in the emergency department, mostly the patients will be brought very, very suddenly, very quickly along with attendants and all. One fellow came one attender came shouting and yelling, Doctor Saab, मुझे बहुत दर्द हो रहा है, बहुत दर्द हो रहा है, pain हो रहा है, pain हो रहा है, pain हो रहा है, chest pain. And I hope you know that is a simple thing that's known as angina. What is that known as? Angina, chest pain. And for the treatment of angina, chest pain, I'm not going into much detail. For the treatment of angina, chest pain, the drug that is being used is NO, nitric oxide. Say me once. NO, nitric oxide. Why NO is used for treatment of this one angina? It does vasodilation. Blood vessel dilate करता है, blood flow फिर से start होता है. One thing. I'll tell you one more thing. Why did I ask you nitrous oxide? Nitrous oxide formula is N2O. Say me once. N2O. And you know what is the use of nitrous oxide? Nitrous oxide, thank you sir, very nice. You are saying the other name of that. Nitrous oxide is very famously known as laughing gas. But you know what is the use of that? That is used for giving general anesthesia. That is used for giving general anesthesia. There is a slight difference in the formula. NO, nitric oxide, treatment of angina. N2O, nitrous oxide, for giving anesthesia, general anesthesia. Now, that doctor who was on duty on that day, emergency department, one patient came there, and you know back in India how, okay na, the patient was shouting like anything, Doctor Saab, dard ho raha hai, aur badh raha hai. And now this doctor, he was not a well-trained doctor, unfortunately. Unfortunately, he was not a well-trained doctor. Now he's turning the face here, and he's thinking, NO, N2O, NO, N2O, NO, N2O. Getting my point here? Nitric oxide, nitrous oxide, nitric oxide, nitric oxide. He's confused right now. He's doing all this akkad bakkad. Finally, he comes to a conclusion. Let me try with N2O today. Let me try with N2O today, nitrous oxide. He gave nitrous oxide. At that moment, the patient who was shouting like anything, Doctor Saab, Doctor Saab, Doctor Saab, Doctor Saab. Why? He has given general anesthetic instead of giving NO, which is actually used for it. उसने उसका दर्द तो कम नहीं किया. He did not decrease the pain, but उसने उसको खामोश बिठा दिया. And that is wrong. That is wrong. That is wrong. Now we are going to take a pledge here. Fine. We are going to learn. Typewriter is giving us a, yes, what is the moral of the story? It's giving us a, final conclusion that you are not allowed to do a mistake. Will you agree, my dear friends? Today I'll say you friends, tomorrow I'll become your teacher. When I become teacher, I'll say you. Okay, na? So my dear friends, my dear budding doctors, today whatever moral I am giving you is that typewriter is teaching us a story that it's not that era of, copy paste. In real life, you can't do that copy paste just by a touch. Okay, na? So remember, once you do a mistake, it will be literally difficult for rectifying the mistake. So that my relative taught me that story. So from that day I started. Today I learn, okay, this is the thing. This is the thing. In my mind, I should be very clear. Tomorrow I should not at all be having a doubt between two options. Clear, my dear friends? This is the thing. And now, to make our doctors very much efficient, to make our doctors of Medico Abroad family here to very much efficient, to stand in front of the world and do treatment of many patients and all those, we are actually doing this program. We have seen all these things, all these ups and downs we have seen. We have spoken to hundreds and thousands of doctors as you are right now, and we have tried to find out their problems. Unki problem kya hai? What is the dikkat? Hai na? Problem kya? What is the problem and all those? And we have finally come to a conclusion. Me, Raghuram sir, Rajaram sir, and all those, we spend hours together behind you. There's a lot of hard work. And in doing so, what is the plan that we have come down here finally is that our plan, that's what I'm coming to the point here right now. Our plan is that, we are always doing the same thing in the other universities also, like in Leoning and all. Even in Belarus, we are doing the same thing here. We are inculcating a program. We have introduced a program for the students, our Indian students, right from very first year. Right from the very first year, our Indian faculties will fly from here to their own campus over there, and we give them a campus coaching every year. For example, in the first year, if you have the subject anatomy faculty will fly from India to the university over there, and they will give the coaching there. Fine. So in this manner, you get a chance to learn with your Indian faculty, with your own language and something like that. That advantage will be totally different one. Apart from that, second thing what we are adding it to that is, once you complete your first year and when you come back to India here, okay, and जब आप यहाँ पर वापस आते हो अपनी summer holidays में, when you come back in summer holidays, again here also we give the coaching of the same subject. In this manner, you are learning the subject twice a year, so that we start your preparation right from the beginning itself. One thing. The same thing will carry on for the second year. Second year respective subjects, third year respective subjects, campus coaching as well as the holidays coaching when you come back in here in summer. And in this way, if a student, I'm not telling you to study 24 hours, okay, no, I'm not asking you to study for 24/7 and all, okay, no. At the same time, when you're doing your personal life, all the enjoyments and all, studies are important, primarily what we are going there for, okay, no. ये सारी चीज़ें बहुत ज़रूरी है, I agree, everything is fine, the eating part, wearing part and everything is fine, but primarily, don't forget your primary goal. I have seen hundreds of students after going there, they forget primarily what they have come there for. ठीक है ना? So please don't forget that. Simultaneously do your studies. So this is our plan. Our plan is that we are actually doing the campus coaching right from first year onwards. And first year the students will study there, and then holidays again they study. The same program will continue, and we have seen tremendous results. We have seen. Please believe me, trust me. I have been teaching from many years to many universities, many foreign medical graduates and all those. We have seen a tremendous change. We have seen students mostly from North India, they will be from Hindi medium. Some of the students from South India will be Telugu medium or whatever regional language. Those students who don't know English, they followed the program nicely right from the first year onwards, and they have cleared their exam from the very first year itself. In the very first year, the moment they come back to India, they have cleared the exam. So that is how the tremendous result we have seen. Now, this is one thing, this is the one program that is we are going on. And now I'll tell you why we are doing this, why we are inculcating all these programs. I'll tell you. Yes, especially I want the attention of the students right now. I want you to just make you people aware of the situation, whatever is going on right now. I'll take few minutes, sir. I want you, especially students, okay now. What happened is, when foreign medical graduates, after completing their MBBS, when they come back to India here, they will actually have to first of all clear MCI. I hope you are aware about that at least. Yes. The foreign medical graduates have to come back here and clear MCI exam, one thing. And after clearing MCI exam, they are registered as doctors here, okay? And after that, they have to write the PG entrance exam here, MD entrance exam here. So all the foreign medical graduates started opposing that this is not good, this is partial. We foreign medical graduates, we have to come back and write down two exams. And Indian medical graduates only writing one exam, okay? And now they were all agitating and all. Finally, government came to a conclusion. I think probably next year, sir? Next year? Yeah, 99% chances next year. I'm just making you aware so that you become serious towards your studies. These are all important for you, for students especially, and much more to the parents especially. So, sir, now government came to a conclusion, from next year, probably 99% chances are there. They are coming up with an exit exam. Exit exam will be the only one exam which will be written by foreign medical graduates like you people when you come back after 5 years or 6 years here. And then that exit exam is the same exam for Indian medical graduates also. They have to write on. And for you people, it's like, when you write down, you clear that. That's also a screening exam. अगर उसी exam में अगर आप अच्छा score करते हो, if you score well in the same exam will decide your MD seat also. So government came to a conclusion. One happy thing, right? Are you happy? You don't have to write two exams, but don't be much more happy. I'll tell you why. Okay, I'll tell you. One advantage, one disadvantage. I'll tell you. The advantage is that, nice, sir, very good. We don't have to write two exams, sir. Only one exam we have to write down here. Fine. Welcome back. Welcome back to India. When you have to write the same exam, my dear students, just change your thinking and think about that. MCA exam now, it was somewhat a bit easy exam. Bit easy. Testing the students at MBBS level. At the level of MBBS, they were testing. It was a bit easy exam. But now, just you people are now mature enough to think. You think, when they are conducting the exit exam for the same MD exam, MD entrance, will they decrease the standard? No, they will increase the standard. Understanding my point here? So it's no more that easy MCA exam. Now directly you are actually writing MD entrance after coming back from your 5 to 6 years of MBBS. Is it okay? Please print this point in your minds. I'm telling you, imprint this point in your minds. Write down in front of your study table, whichever room you are allotted in. Understanding? After 5 to 6 years, when you're coming back here, you are directly going to attempt the MD entrance exam. That is why we have worked out a lot behind this program, and we have started this one. Ke hamare students, they should not come back here and spend a lot of time and waste the time every 6 months, every 1 year, only attempting the entrance exam and all. That is why we have planned like this. And I think any student who follows this program right from first year to fifth year, doing the subject simultaneously, all the entrance simultaneously, I guarantee you, sir, after coming back, you will clear the exam in the very first attempt. Are you all understanding this one here? Is it practically possible, or am I speaking something hi-fi? Come on, yaar. Okay, you people have become serious now, huh? From that time, music was floating in. From that time, people were singing. From that time, people were dancing. And the moment I shifted your concentration, now welcome back to the primary thing why we are going. See now the faces. Okay, but don't lose that. That is why I always tell the students, okay, you please balance your two lives, personal life and professional life. Don't be personal everywhere. Personal outside the classroom, personal inside the classroom, even outside the classroom replying to WhatsApp, Facebook, inside the classroom replying to WhatsApp and Facebook, it's not good. So balance your life. Personal life, professional life. When you're outside the class, yes, nicely you enjoy your personal life. When you're inside the class, yes, 100% you have to be in the class and do it very professionally. See how your life will emerge out. Fine with this one here? Is it okay? So, my dear friends, I'm telling you, next year 99% exit exam is going to come. When you come back from your Belarus after completing your entire MBBS, you are the one who are going to actually attempt the directly MD exam. So, please be ready for that. One thing. And second thing, apart from this, in our program, as sir said, we are also, introducing this USMLE program. Already we have been teaching. Right now, even like today also, after completing this program, I have got one online class to be done after going from here. So varied students from different places, different countries. I have to go through them. So all those things we have been inculcating. We have been providing education to many of the students, USMLE also. And if you are ready for that, we welcome you, sir. Okay, we welcome you. Not only ready, I insist you to go ahead with that one. That's something a different level, USMLE and all those. After completing your second year, you start. First step, you'll just have 7 subjects of first year, second year. If you are very thorough with the basics and all, as I told you, NO, N2O. Okay, na? So just be thorough with your basics and all, then you'll easily will be able to do that. Is it okay? Fine. So please keep this all these things in your mind. Please be aware of the situation in your surrounding. One more thing to finish off this one here, I'll tell you one more thing here is that I'm saying one thing, I'm very much, sad with that one, actually. Most of the students who are going to foreign medical universities, students and even their parents and even their, all their associates and friends and everyone, I'm very much sad about this one, कि they are only worried कि मेरा लड़का MCI clear करना चाहिए. My wish is that he clears MCI. Okay, now, my student should somehow clear MCI. Yaar, come on. You yourself are inhibiting your child. You yourself are inhibiting your goals. Come on, think. I don't want my student to stop at the level of MCI. Why? Because think right now. I'll tell you one story here. Think right now. Suppose you get a pain in your joint. I'm asking the parents here. If you get a pain in your joint, where will you go? Where will you go if you get a pain in your joint? Orthopedician. What is this year right now? 2017. Just think back 10 years back. Just think back 10 years back. We used to go for a fever, for a cold, for diabetes, for hypertension, for a pain in joint to a fellow in our lane. है ना? जो हमारे नुक्कड़ के कोने पर होता था, हम हमेशा right from common cold up to diabetes, hypertension, we used to go to that fellow. Nowadays, era has changed. Sir is giving an example here. Nowadays, the era, so no doctors, seeing the answer, he's your patient tomorrow. I don't want him to be, but still I'm telling you, I'm just trying to give the thinking in your mind. What is the thinking? What is the thinking that I'm trying to inculcate in your mind is, now the people who are sitting here right now, the people outside there, their thinking have changed. 10 years back down the lane, they used to go to MBBS doctor. Nowadays, era has changed for anything in problem in eye, ophthalmologist, problem in joint, orthopedist, something like that. Understanding my point here? So, my dear doctors, if your final aim is only MCI, you are just a doctor, you come out after, from Belarus, you come back 5 to 6 years. Yes, I'm MBBS doctor. Down the line, 5 years, you have to think. Come on, start change your thinking. Don't think today. Even today, it's the era of specialty. Once you complete your 5 to 6 years of MBBS, it will be the era of super specialty. Will you agree? Will you agree? I'm just making, sir's responsibility was making you aware with all the belongings that you have to carry. My responsibility here is to make you aware of the situation here right now. Understanding my point here? It's a screening test which is giving you a credibility to practice here. That is not the final goal of our life. Understanding, my dear friends? Are you getting my points here? These are all going to play a role. Okay? तो इसीलिए मैं कह रहा हूँ ऐसी थिंकिंग मत रखो. We are right now itself we are in the era of specialist. I am telling you next will be the era of super specialist and all those things. Is it okay? So I welcome you all again to the family of Medico Abroad. And second thing is that I wish you all the best. And last statement that I would like to say you is that I was seeing your faces when you were giving your introduction here, all you students. You were really proud to introduce yourself and your parents. Were you proud or not? Yes, we have come to this stand. Now it's your turn. Make them proud. Now it's your turn. Make them proud. Will you make them proud? I want to hear a loud sound. Will you make them proud? Will you? Or will you be still searching NO or N2O? Okay.